From KGW News, this is Straight Talk with Laurel Porter.
Hello and welcome to Straight Talk. I'm Laurel Porter. It is hard to believe, but we are already just a week or two away from the start of the new school year. A lot of students have no doubt been enjoying the time they've had to sleep in before those early alarm clocks go off again. School start times vary across the state, but a local group of students has started a conversation about shifting those start times later to no earlier than 8:30. Studies have shown that teens would benefit from more sleep, and graduation rates would improve, among other benefits. But in some districts, parents, teachers, and district officials push back on the idea, citing family scheduling and transportation challenges, as well as concerns about cost. The state of Oregon, as well as much of the rest of the country, is also facing another dilemma: a sharp increase in student absenteeism in the wake of the COVID-19 pandemic. In this episode of Straight Talk, we'll look at possible solutions, including the possibility of later start times. We'll hear from students, a pediatrician, and a lawmaker. My guests are Alvin Chan. He's a 2024 graduate of Cleveland High School and a co-chair emeritus of the Multnomah Youth Commission. He's served on the commission since 2018. He was an intern at Portland Public Schools from 2021 to 2023. Alvin is headed to Princeton in the fall for college, but plans to continue to engage on the issue of later high school start times. Adithi Subramaniam will be a senior this fall at Catlin Gable. She joined the Multnomah Youth Commission as a sophomore. She is the current commission co-chair and MYC liaison to Portland Commissioner Dan Ryan. The Multnomah Youth Commission, or MYC, is the official youth body for the city of Portland and Multnomah County. It includes a cohort of 30 youth, ages 13 to 21, connected to the city or county. Their mission is to include youth voices in civic issues. The Education Youth Voice Committee has taken on this issue of later school start times. Also joining us, OHSU pediatrician Dr. Ben Hoffman. Dr. Hoffman is a nationally recognized expert in child injury prevention and education. He serves as director of the Tom Sargent Safety Center at Doernbecher Children's Hospital and as director of the Oregon Center for Children and Youth with Special Health Needs. Dr. Hoffman is a professor of pediatrics at Doernbecher and currently the president of the American Academy of Pediatrics. And we're also pleased to have with us Oregon District 48 Representative Wah Win. She represents East Portland and North Clackamas. She's currently a student and community engagement specialist at the Clackamas Education Service District. Representative Win is a member of the David Douglas School Board, where she served as director. She has 20 years experience in the education, nonprofit, and youth sectors and serves on the Oregon House Education Committee. And she's also convened an informal work group addressing chronic absenteeism. Welcome to my guests, Alvin Chan, Adithi Subramaniam, Dr. Ben Hoffman, and Representative Wah Win. Welcome to Straight Talk. It's great to have you all here. Thank you so much.
Thank you for having us.
Thanks for having us.
Yes, thank you for having us here.
Well, let's go around the table and just talk about why you're so passionate about this issue. Now, Alvin, you have worked on this for a number of years. Even as you get ready to go to college, why do you feel so strongly about it?
Yeah, well, one of the things that I really feel passionate about is giving back to our community. I was born in Oregon, born and raised here, and I really feel like I have something to give still to our community. I've been on the Youth Commission for 6 years now, and I love the work, and I don't really want to stop.
Well, Adithi, you also have some personal experience. You've worked on the Multnomah Youth Commission. From your experience, why are you passionate about this issue of later start times for high school?
Yeah, well, first of all, I really love the MYC community, and in working with my peers, I've learned that I've benefited a lot from the 8:30 start time at my school, but that's not necessarily the same experience for my peers who really struggle with those earlier start times. And I've even seen that effect on my older sister, who in high school also had an earlier start time. So I feel really passionate about just giving a voice to youth and empowering them to talk about what matters to them.
Well, I want to hop over to Dr. Hoffman because I came across a 2018 OPB article that had a picture of you with former City Commissioner Steve Novick addressing the Portland Public School Board and lobbying for these later start times. So this is something you've thought about for a long time. Why are you passionate about that and overall student outcomes?
I think as a pediatrician, my goal and the goal of my colleagues is to ensure that every child has the opportunity to thrive to the greatest degree possible. We begin and end with the science and what we know about kids, and part of what we know is that early school start times just don't work for them, especially as they become high schoolers, and so being able to partner with experts and advocates across sectors, including, and most importantly, the youth voice in this, has been a real joy. And having the opportunity to think about it on a broader stage is really great.
Representative Nguyen, tell us a little bit about your background and why you convened this work group to address chronic absenteeism.
Well, thank you, Laurel. I'm an educator for a long time, but most importantly, I'm the eldest daughter of refugee parents. So I know what it's like for students of color and students from working backgrounds to show up in school ready to learn. And I remembered when I was a convenience store kid, so I would spend my childhood every day after school and weekends helping my parents at their business. And there are times where I remembered where I had to miss school because my mom was sick, or I had to help out with my siblings with their homework. So I know that early on, being the daughter of immigrants, that I had to take on a caretaking role as a child. And so I bring that lived experience to my work as an educator, working with students and families. And mostly I've worked in Portland Public School, and for the last 10 years, my career has been focused on addressing chronic absenteeism. And that was, I've done hundreds of home visits. I've met parents at their homes. And one particular story I would like to share was when I was working in Portland Public School in Northeast Portland, there was Jason Lee Elementary School, which was a K-8 school at that time. And one of the strategies we used was using a walking school bus to address chronic absenteeism. And through that walking school bus, I've learned there was a few motel families along 82nd Avenue that was struggling with poverty and mental health issues. And so that's the lived experience, and I'm really grateful to have this opportunity to really convene a work group to really bring in my expertise around this work.
And we'll dig in more into the reasons behind that absenteeism and the science behind these later start times in a moment. But before we get into that nitty-gritty, I want to find out more about the MYC, because a lot of people might not know about it. So Aditi, tell us what the Multnomah Youth Commission is all about.
Yeah, so the Multnomah Youth Commission, as you mentioned before, about a group of 30 or so youth, ages 13 to 21, and it really focuses on youth who are connected to the Multnomah County and the city of Portland. And it's a platform for youth to really amplify their voices in their community, to amplify their voices to even people like who are in the legislature, people like Dr. Hoffman, to really push forward what matters to them and have their voices heard where they usually aren't.
And so, Alvin, how did your group decide to focus on this issue of later high school start times?
Well, let me start with before I joined the Youth Commission about a decade ago, the Youth Commission, on folks on the Education Youth Voice Committee, went out into the community to join focus groups with students across the city to find out why students are not going to school. We came up with a list of, I think, over 30 policy recommendations, and the top one that we found was most effective was the issue of start times, and how do we get it to where students are able to get up in the morning, not feeling terrible for school, getting breakfast in the morning, not rushing to catch the bus, things like that. So after a lot of extensive research with scientists, we looked at research papers, we've went out into the community, we've surveyed schools, high schools specifically. We landed on this is one of the best things we could do, we could advocate for to ensure that students are going to school.
Well, Dr. Hoffman, tell us more about the science behind these later school times, especially for high schoolers. How much sleep do teens need?
So one of the first rules you learn as a pediatrician is that kids are not little adults, and that extends to adolescents, even though I as a pediatrician take care of youth who are larger, taller than me. We see high schoolers and think that they're adults. During adolescence, especially after puberty, the sleep-wake cycles, what we call the circadian rhythm, the 24-hour rhythm, actually changes. Some of that has to do with metabolism and secretion of melatonin, which is a hormone that's associated with sleep. Some of it has to do with other brain functions and just developmental changes. And it turns out it's very difficult for most adolescents to fall asleep biologically before about 11 o'clock. Mm-hmm. We have not met kids where they need us to be, and we've established schools that tend to have earlier start times, and that really goes back to an anachronistic system in an agrarian economy where kids were necessary to do chores in the morning, then go to school, and then come home and help with chores in the afternoon. And so when we look at the fundamental biology of adolescence, we're doing them a disservice by asking them to get up early to show up at school before 8:30. And the science that we have, and there's a very robust scientific literature around the benefits of delaying school start times to 8:30 because it meets kids, like I said, where they need us to be.
And Alvin, you mentioned that you had talked to students. You have a survey that you provided us from the Multnomah Youth Commission. You talked to some students in the area. Tell us about the survey results.
Yeah, I think two come up for me. One we did at Reynolds High School in 2022 with I think over 800 responses from students and staff. 74% of the students there said that they would favor a start time of 8:30 a.m. or later. In 2017, we had a survey at Portland Public Schools, all high schools in PPS. 88% of those students said that they would prefer a 8:30 a.m. or later start time. So we're very encouraged by these results. We recognize that this is just the Portland area schools, but we are very happy to continue going out to see what change needs to be made and what people feel about the change.
And PPS is starting to classes now at 8:26, I think, in order for more instruction time. And Beaverton just announced it's shifting to a later school start time. And Aditya, you mentioned a little bit about this, but what impact have you seen for kids you know, the early start times? How tough is that on teens?
Yeah, I mean, as I mentioned, I have an older sister, and I saw her go through the high school process before I even started high school. And those early mornings are really just not in tune to teenage bodies. I see many of my peers and even my elder sister skipping breakfast, rushing out the door, not being groggy, not super alert. And first period classes for a lot of my peers I've heard are quite a struggle. And even driving on the roads as a groggy teenager, certainly that's a big worry. I mean, my parents, they worry when I drive, they worried when my sister drove, and I think that's a relatable experience for most parents, having a tired teen on the road.
Yeah, that is a constant worry. I can say that from my own experience too. Dr. Hoppin, what are some of the other benefits to sleeping in later for kids?
So first of all, one of the things we know is that when we've looked at the impact of delayed start times, students don't tend to go to bed later. They don't shift so that they're actually getting more sleep, and we know that that's a huge issue. Pretty much anything you can imagine, from academic performance to absenteeism to decreased risk for car crashes to increased sports performance. Pretty much any measure that you could think of gets better with delayed school start times for high schoolers.
Representative Nguyen, let's talk about the absenteeism, the chronic absenteeism. What is chronic absenteeism? Define that for us, and what are we seeing in Oregon?
Yes, and chronic absenteeism, as defined, is looking at all reasons of absences, both excused and unexcused. And the message is that anytime a student misses class, that it impacts their learning in the classroom community. And so it's missing 89% or below, which equates to about 2 absences per month, or a total of 17 absences per school year. And we know that it's a national issue. In Oregon, unfortunately, right now we rank number 4 in the nation with one of the highest absent rates. And this is not a pandemic issue. This was something I recognized in 2018 as I was tracking the data in my work as a school attendance coach in Portland Public School. And unfortunately, COVID happened, and it just exacerbated the challenges even further. And we know that this issue is linked to many infrastructures, as what we are hearing out from today is one of them is possibly start time, but as well as is linked to poverty, homelessness, and right now we're seeing increased mental health challenges amongst our youth in schools right now.
So later school start times could be one possible solution. What else are you looking at in your work group when you're looking at chronic absenteeism?
So first thing is to note that we have been doing this work for a long time in the state of Oregon, and so through this work group I have seen tremendous work on the local level across the state, from Southern Oregon to our metro cities and Portland Public School, and also on the coast. And so we're all working in silos right now, and so the goal is how do we scale this up across the state to have better outcomes. And I think first and foremost is data. And so we need to be able to have data that is clear and visible and accessible, and so that way we can really identify those root causes. And also we're looking to develop key partnerships. So we're working closely with the Oregon Department of Education as well as Oregon Department of Human Services. And so we heard from a number of stakeholders, and the idea is that it's not about reinventing the wheel, but about how can we all play a role in increasing this outcome for attendance for all of us. So if it's a matter of this community effort, of all of us doing our jobs well, whether you're a student, a parent, a teacher, or a legislator like myself, or a doctor or a pediatrician, that we all have a role to play in this to really improve the outcomes for our young children, especially to chronic absenteeism.
And from a doctor's point of view, a pediatrician, how does this chronic absenteeism fit into the bigger picture of this behavioral health crisis that a lot of students are facing?
Yeah, so thanks, Laura. We are in the middle of an absolute national emergency in mental health for youth. And we think, as pediatricians, of absenteeism as a vital sign. And it's something that we are encouraged to talk to kids and families about, because that often is a proxy for a lot of the social drivers, social determinants of health that we know really go into making a person healthy or not. And it could be associated with poverty. We know that there's a massive issue of equity with minoritized and marginalized communities disproportionately impacted. And by identifying, ideally, kids and youth at risk for absenteeism before they fall into absenteeism can help us not only address the needs for that kid, but to start to work with change makers and policymakers to think about it at a structural level so that we can impact policy and prevent it.
Well, Aditi, when you did your research on this with the MYC, what were some of the points of resistance that you heard from people to starting later?
Yeah, the most we hear, especially from parents, is the issue of transportation. Parents really want their kids to be in school, to learn, to get the education that they deserve, and a big part of that is how are they going to get to school. Often we hear that with schools that have made this later high school start time change, transportation is actually listed as a reason why they made the change, to ameliorate some of the issues that they were having. So ultimately we're seeing that while at first implementation can be hard and change as always can be hard, the long-term benefits, especially the health benefits mentioned by Dr. Hoffman, are really worth it in the long run. And
Alvin, we have a slide that you provided from MYC with benefits by the numbers. Let's just take a look at that, and including economics and maybe surprisingly increased free throw performance?
Yeah, absolutely. So what we highlight is that this really covers many facets of student life and benefits for parents, for districts as well. So as to the economic benefits, nationally we see if the country were to move to 830, we would see about $8 billion conservatively over 2 years. But that is at the local level, we see many districts changing their start times because it does lead to fiscal savings in the long term. Things about free throw accuracy, 9% greater free throw accuracy for our basketball players.
Well, that's both changing right there.
That's one reason right there. But that highlights, that goes to sports injuries, right? Lower sports injuries, you're more focused in the morning, you're getting more out of your education. And these are all great benefits for the long term. It's not just staying up late so you need to wake up later, but really we emphasize the health benefits, the physical health and the mental health benefits to students and the benefits to the wider community.
Well, thank you so much. It's time for us to take a break. When we come back, we'll find out what the students have learned during their work on the Multnomah Youth Commission and what may be next to help improve student outcomes. We're back in 2 minutes. Welcome back to Straight Talk. I'm Laurel Porter. As we get closer to the start of the 2024-25 school year, we're talking about a student-led conversation to give teens a little more sleep before they head to class. And we're also hearing about work being done in the legislature to improve student outcomes and address chronic absenteeism. Joining me are 2 students from the Multnomah Youth Commission, Aditi Subramaniam and Alvin Chan. Also joining us, Oregon State Representative Wah Win, a member of the House Education Committee, and Dr. Ben Hoffman, a pediatrician at OHSU. Thanks again, everyone, for being here. I want to start with Representative Wynn this time. Tell us what's next in the legislature in your work group. What do you hope to achieve before the next long session?
Yes, and the reality with legislation that it takes a long time for implementation. So there is a lot that we can do in the interim. And so in partnership with Oregon Department of Education, we are going to be introducing a proclamation to make September Attendance Awareness Month, and really creating that message of how the importance of attendance, and also supporting school districts on how what type of messaging they can to really encourage students and parents to keep our students engaged in their classrooms.
What do you think the timeline is for a possible bill?
Well, we are coming up on a long session in 2025, and so that's what this interim is about. We've met already 6 times as a work group, and we've heard from a number of stakeholders, and this work group includes a group of stakeholders within administration, as well as school board, parents, youth voices across the board. Also, we have a special education perspective in this work group as well. And so we're hoping to be able, the goal is to have a call to action of reducing chronic absenteeism within the next 5 years by 50%. So it's about getting us in the right direction to improving attendance. It's not about perfection. We know that there's a lot of complexities that we don't have control over, but the idea is how do we get back on track to get better outcomes. And so we're hoping to maybe possibly introduce a package of varying policies that from different infrastructures to support better outcomes for our students in regards to attendance.
Alvin and Aditi, you've done so much work on this issue of later high school start times. What have you learned? I'll start with Alvin.
Yeah, I think over my 6 years, I've been able to just have so many opportunities to meet with folks like Rep. Wynn, like Dr. Hoffman, and so many other stakeholders, and that opportunity to be able to engage in civics before I'm even able to vote is just such an opportunity. And I know that it's an opportunity that so many youth in our community, in our state, are yearning to get.
When do you get to vote?
I get to vote this year.
Oh,
so, yeah,
well, good for you.
I'll be voting soon.
Well, let's hope everybody, all the youth, get out and vote. What have you learned, Aditi?
Yeah, I mean, on the last 2 or 3 years on the NYC, I've really just enjoyed working with such a unique group of peers that really build to the one NYC, and it's just been great experiences to get involved in my community and do things like this, be on Straight Talk, and I think that that's an amazing opportunity for any youth.
Well, we're so happy to have you here on Straight Talk. And Dr. Hoffman, what are your hopes about this effort to improve student outcomes, later high school start times, addressing chronic absenteeism from a pediatrician's point of view?
This is a fantastic opportunity to do what pediatricians do, which is put kids and families in the center and work to bridge all the different sectors, all the different parts of a community that have an investment in, or that need to invest in kids' well-being and their opportunities to thrive. So being able to bridge the issue of health and education, to bring families and communities in, and especially to integrate the youth voice, this is part of why I do what I do, and I couldn't be more excited about it.
Well, Alvin, you head to Princeton in the fall, but you've told me that you plan to continue to work on this issue of later high school start times. What are your dreams for this?
Yeah, well, this upcoming year we're bringing on a new cohort of NYCers, and just so ecstatic to see what they're going to do with this work. I still think I have something to give, so when I'm there, I'm here to support all our new folks. We have one of the most diverse cohorts this year that we've ever had, so I'm very excited to see what's coming up, and I don't really want to leave this work that I've been doing for so much of my life right now.
Well, we appreciate what you've done, and good luck at Princeton. Aditi, for young people watching who might want to find out more about the Multnomah Youth Commission, I know you have your cohort for this year, but this would be for the 25-26 school year. How do they apply? We have a website we can show folks.
Yeah, so we'll be starting recruitment around March, applications in April, and you don't have to already be advocating for something. You don't have to have been on Straight Talk. It's really about any youth who want to be empowered to amplify their voices in their community and be involved and engaged, and anyone who feels that way should really apply for the next year.
And so you can go to the website there, Multnomah Youth Commission website. Alvin, I want to give you the chance. We have about 25 seconds for you a final thought you'd like to share.
Yeah, well, first of all, thanks so much for having us on behalf of the Youth Commission. Just for your viewers, folks out there, if you're a young person, especially if you're not old enough to vote yet, please do consider applying. You don't need any formal experience. There's no cost to the program. And if you are yearning to be part of the change, if you want to lead a project, if you see some injustice in your community, that's exactly what we're here for, and we're excited to see your application next year.
Well, thank you, Alvin, Adithi, Representative Nguyen, Dr. Hoffman. Thank you all for the work you do on behalf of our young people in Oregon. We appreciate you. And thank you for watching and listening to our podcast. You can find our podcast wherever you get your podcasts. Search for KGW Straight Talk. We'll see you next week for Straight Talk. Have a great week.